Good evening. You're watching PBS 39, and this is Healthline Cosmetic Surgery. Our topic of conversation tonight is body contouring. We're going to specifically zero in on liposuction and tummy tucks, but we can also talk about some of the other topics that surround body contouring as well. Our guest expert who is here to answer your questions is Dr. John Mancall. So easy to get in touch with us. Just dial the number you see on the screen at any time throughout tonight's show to share your questions and comments about body contouring. I want to thank you so much for joining us.
Thank you.
Could you start us off by describing what body contouring is?
Sure. It's as simple as it sounds. It's when we're trying to go ahead and re-contour the body to a shape that someone feels like they should have or one day had and is lost through weight gain or childbirth and the changes that happen.
When someone is considering liposuction, who might make a good candidate for that type of surgery?
Well, liposuction, a lot of people try and use it as a weight loss program and say, can you just suck out a few pounds, doc? And the answer is, of course, no. It's really designed for where there's a little extra fat that's accumulated. You're trying to sort of smooth out or get rid of some of the extra ripples or rolls. It won't make skin tighter. It won't make muscles tighter. It's just sort of some of the padding.
Now, some people, so we can have realistic expectations as what can be accomplished by liposuction. Can you describe for us, maybe show us some pictures of what can be done?
Sure. First off, there's just some areas that are great to liposuction. There's others that are a lot harder to do. We have a little diagram that shows some of those areas. And when you sort of look at where the yellow is on this, those are some areas that are really amenable to liposuction. The tissue is loose enough where you can sort of remove the tissue, the underlying fat pretty easily. There's other areas where there's a lot of what we call adhesions that are designed to attach the skin to the underlying muscle frame, where liposuction is less successful and we see a little bit less response there. But all of these areas, whether it be the upper abdomen, lower abdomen, kind of that little poochy area from the belly button down to the pubic hairline, the hip rolls. This is a patient that underwent liposuction. You sort of look on the left-hand side, there's pre-op, the right-hand side is post-op. And she was unhappy with the fullness around her belly button above and below. And when we look at that, we can sort of see a real big difference just with taking out probably somewhere around 1 liter of just fat. And here we see the side view. She's had no significant weight loss between the pre-op and post-op. We didn't remove any skin. This just simply was what liposuction can do in the right patient. And I think one of the keys about this is you have to really pick the patients right, properly. Otherwise, they won't be happy, and you won't be happy as a doctor.
So if somebody would come in thinking, well, there's some things about my body shape that I don't like, that I would like to change, and they might come in saying, I want this, this, and this, how does one rein them back in and say, here are the realistic expectations, and here's what you might need to do to keep yourself looking this way after surgery?
Sure. It's real common for folks to come and say, hey, I want liposuction after I do an exam and I see a lot of stretch marks on their skin, or when I have them tighten their stomach and then relax, there's a big sort of bounce effect there, a lot of difference. You know that liposuction is not going to make them happy. So you have to sort of refocus those folks and say, listen, liposuction may get rid of some of this fat, but when you look at your skin, this is actually going to be made worse because that skin won't tighten up because it's already stretchy and droopy. If we take out the filler, just like if you were to lose weight and your pants get baggy, your skin would get baggy too, and you may trade one problem for another. So some people say, hey, that's fine, I don't mind having a little loose extra skin, and you just do liposuction. And there's other folks that the bigger problem may be that they don't like their skin, and that's where tummy tucks may come into play a role.
Can you talk a little bit about planning for a surgery? I know anytime before somebody gets a surgery done, there's certain things that they should perhaps eliminate from their lifestyle, and perhaps some things that they should be doing.
Sure. Well, I think more than anything, if someone's interested in having cosmetic plastic surgery, you need to find out about the surgeon. If they're not board certified by the American Board of Plastic Surgery, then they haven't had the training, as far as I'm concerned, it takes to do this. And not every plastic surgeon does every procedure, so it's also good to ask them, is this something you do and you like to do? Chances are if they like doing it, they'll do a much better job, and if it's just something they do every now and then. But with that said, I think that you don't come into surgery like a tummy tuck or liposuction and say, hey, I'm going to bulk up ahead of time, okay? Usually a good diet and exercise program should precede the visit to the doctor. A patient should be close to their goal weight. Now, not everybody will get there, but should be close. And there's a lot of patients I see that come in preparation for getting there maybe 6 to 9 months ahead of when they think they want surgery, just to make sure they're on the right track and sort of I kind of like to give them the encouragement, the reinforcement they're heading the right way, but maybe help them set a reasonable goal for what they want to do ahead of time. Once we've decided we're going to go to surgery and we're ready to do it, we have to also make sure medically it's a safe procedure for them, because there's nothing that grabs a headline like patient dies from liposuction. And we look at the tragedies of a few years ago when patients were doing what's called massive liposuction, where they'll take off 15, 20 liters. We found that that was just too much. And although a lot of patients, you got away with it, it only takes one to really put a blemish on the procedure. And most of those folks, it simply was just too much of the numbing medicine got into their system, and there was toxicity from that was ultimately the cause of their demise. So we have to set realistic goals of what this operation will actually do for you. And I have some folks that what I do is I do stage procedures. I may do liposuction in preparation for a tummy tuck, or we do tummy tuck and then later do liposuction, depending on what their health dictates and what their recovery time is they're looking to put into this. And all those questions need to be answered ahead of time.
Are there any situations, say with a person's health, that might restrict them from having any of these procedures done?
Well, certainly obesity, I guess, would probably be the biggest ones. Super morbid obesity, when you're really very large, you're just not a candidate. Now, we sort of split hairs a little bit in that some of these folks that are so big and their bellies hang over, it impairs how they can walk. We may remove that, and we call it peniculectomy. And it's kind of on a continuum with the tummy tuck. It's just not done for the same reasons. But assuming that their weight is in the right place, most other chronic diseases can be controlled, whether it be diabetes, hypertension. I've even done this on folks who have had kidney transplants and other types of situations like that, because it's a very safe operation. And like I said, I think if you keep your goals in a realistic range, you're not going to get anybody in trouble.
When we're talking about getting answers that a patient needs, I mean, separate from, is my surgeon, board certified, how many of these surgeries have you done of exactly this kind? Are there other safety precaution questions that a person should be asking?
Well, I think where you do this is important. Is a facility, is it a certified facility? You like to assume your instruments are clean, and as a doctor I like to think where I go they do everything they should. But you also want to understand who your anesthesiologist is going to be, and let's say some people don't have all the help at home that I'd like for them to have. Can they stay overnight? Do we have other facilities for that? We call 23-hour stay. There's a surgery center Southwest, Southwest Surgical Suites, where I do most of these, where we can accommodate all of those. We have a core of anesthesiologists we like to use that are familiar with what we do and therefore what our patients can expect. We have the ability to keep folks overnight, just to get them through that first night, which can sometimes be the hardest, and then really help them as they go home and transition them into that home environment.
Now, you're mentioning time to recuperate with the place that you have someone to help you. How long is recuperation generally for a procedure of this nature, and what things should a person avoid doing perhaps immediately after surgery?
Again, it comes down to what do you do. If it's simply a little bit of liposuction around your belly button because you have a little poochy area there, you can be back to work the next day. Maybe a little bit sore, feel like you kind of worked out a little hard. And it doesn't take much in recovery at all. If we talk about some of the circumferential tummy tucks we do, where we make the incisions all the way around, you're talking 3 or 4 weeks sometimes with someone really with you most of the time the first couple of weeks, driving for about 3 weeks. It's really, the more aggressive the surgery, the more we're trying to achieve, as you would expect, the longer the recovery.